All right. Be recording. Should be good to go. All right. Welcome, everybody, to the Office of Research and Innovation's grant funding search webinar today. So today it's going to be a lot about finding funding, but then also using a cool tool that the university spent, I don't know how much money, but I'm assuming it's a lot because it's very useful, to help faculty and staff find funding for their programs, research, and if you're a student, there's opportunities for students as well, not just for research, but also for scholarships as well. Sort of a hidden bonus that I'm not sure they really intended when they signed up for the platform, but um, it's a good funding. So, all right, just to give you kind of an overview of what we'll be doing for the presentation, it'll be two main learning objectives, just so you can identify who potential funders might be. It's often a good idea to know going into a space who probably would be interested in funding your research or your program. Um, so I'll give you sort of an overview of the federal and non-federal side of it, and then we'll go to using grant search tools to identify funding opportunities. So that will be the tool, which is called Pivot RF. If you should have all like at least tried to get into Pivot RF, or RP, one of those two. You should have all at least tried to get into it, but if not, I'll show you how to get in there. It's very easy. So let's see, next slide. So just a couple of terms for people who might not be familiar with the alphabet soup that is grants. These are all terms that mean the same thing. They are basically a public notice saying we are wanting to fund this type of program. These people are eligible. It is due by this date. And most of the time, they're also telling you how much they're willing to fund. Sometimes they don't. Um, and it's usually cut, it can be anywhere from a page or a couple paragraphs to 50 pages. But just an idea, so you may hear people say different things. I like to use NOFO because that's what a lot of federal proposals use. But there are common terms across both federal and non-federal. Private foundations will use some of the things as well. Um, Program announcement is pretty much exclusive to research proposals. So that would be the NIH, NSF, and national academies. Um, Terms. Other ones you'll see as you're starting to read things that may be a little bit weird. Letters of intent. Usually they're not, sometimes they're required, sometimes they're not. That's an important thing to note as you're looking to see, okay, what are the deadlines? What am I interested? What can I feasibly do? This is you writing a letter saying, I intend to apply for this grant. Um, Sometimes they're required because they want to basically screen out programs that they know absolutely won't fit. Sometimes they're just helpful for the funder. So the NIH, I don't believe they require letters of intent, but they recommend it so that they can know how many reviewers they need to have for any given funding opportunity. Um, so make sure to see if that's there, whether it's required or not. And then they usually have specific things that they want to go into that proposal. Cooperative agreement is another term you might see. It is a type of grant, and it's a type of grant meaning it's a cooperation. So usually they'll say the funder will do these five things, and then they expect the grantee you to do other five things. And then sometimes there might be a third party, usually like a technical assistance provider, or maybe a third party evaluator who isn't necessarily part of your grant proposal, but they might also have things as well. And so it's really supposed to be a partnership. Um, but in all actuality, it just ends up being a different type of grant. Project director, principal investigator, or PI, or PD. These are the people who are responsible for the grant, and ultimately, these are the people where the buck stops. They're responsible for leading the grant, making sure all the funds are appropriated properly, all the reports are due on time. Um, this is the person that whatever your funder is going to always be contacting to see why haven't I gotten this? Are you spending things correctly? So you're the leadership role, but it's used differently depending on the funder or the proposal. But they basically mean this is the person in charge. And lastly is a notice of award. The NOA is typically a federal term, but sometimes it's used by others as well. But this is the binding notice that says, hey, we got the award. And then usually, especially for federal grants, these are the terms of your award. And they have some standard ones that are imposed on them by Congress, like you can't use grants to buy drugs. You can't use grants to pay more than a certain amount of a salary. So if you have a $500,000 salary, which good for you, there's only you can only pay up to a certain amount of that salary. There's a couple of other ones too, but then they might have other terms like saying, you forgot to include a resume for this personnel. We need that resume before we can give you all of the funds. So it's a very important if you are awarded a grant and you do get a notice of award, read everything. Some of it may seem like boilerplate language that doesn't apply to you, but sometimes that means there are other things buried in there that you need to know. And reading things carefully is a very important part of getting a grant and then managing a grant. And then lastly, you will have, if you're awarded a grant, a project or program officer. Sometimes these are even actually listed on the notice of funding opportunities. These are the people who might not necessarily oversee the selection process, but they'll probably be the people you'll be in contact if you're awarded. So they'll have a good idea about what the programs are that they're expecting to be funded under this, how much funding is available, questions about, okay, I was going to do this, and you say you want to do this. Is that close enough to what we're doing to do? Would that be allowable? Sometimes they'll answer those questions, sometimes they won't. But as a good person to note, and it never hurts to ask questions when looking at grants and deciding if you want to apply for it. It's better to ask questions now than to misunderstand and then either not get the grant or get a grant and then have to completely change something because what you thought was the case actually wasn't the case. So this is by no means the landscape of federal funders. Like these aren't all of them. These are mostly the health ones, actually. There's ones like the Department of Defense that aren't on here that are also doing some health funding, but not as much. It's mostly research related. But these are sort of the primary ones. So these are ones we've, as USD, have applied for or have looked at applying for in the past. The Agency for Health Quality Research, Healthcare Research and Quality, the name on the box is basically what they do. They fund health research focused on patient safety, technology advancements, and improving healthcare economics, basically, finding affordable ways to increase efficiency in healthcare delivery. So if you're doing any research on insurance premiums, healthcare marketplaces, any kinds of purchasing things for healthcare, AHRQ might be a good one to look at. And again, they're probably one of the few federal funders that are looking specifically at data and technology and how that relates to quality outcomes. CDC, very big one. Basically, if you have a public health initiative, CDC would be where I would tell you to look first. They fund a variety of different things across a bunch of different proposals from cancer, heart disease, minority health. There's a bunch of different things that they're looking at, both infectious disease and non-infectious disease, and surveillance is a big component. So they will always, for a CDC proposal, they will be looking at surveillance, so identifying diseases, both non-infectious and infectious, and then also prevention of those diseases. So if you're ever thinking about a public health initiative and it has both of those components, CDC is a good fit. Or if you're looking specifically at prevention, you might want to think, well, how can I add a surveillance component or work with someone who is doing surveillance to get to it? But surveillance and prevention, those are the two big things the CDC does. Department of Labor. This is one we've gotten grants for in the past. Specifically, Department of Labor has a bunch of different bureaus and they do a bunch of different things from, labor relations to, workplace safety. But the one focused on specific education and training is the Education and Training Administration. They fund a variety of local workforce development programs. Unemployment assistance is funded partially through ETA. The goal is to train for high quality jobs. And what that means is that is a job where the credential you have qualifies you to do a job and it gets you a good, fair wage and you're satisfied, basically. It's a little bit nebulous how they define it, but they want people to be fulfilled and happy workers. and making a wage that they can live off of. They usually require partnerships with employers and state government because workforce development isn't really something you do alone. You need to have a lot of partners. So if you're looking at Department of Labor or looking really at any workforce initiative, it's always good to think, what kind of partners do I have? Um, but Department of Labor will expect that from the get-go. So if that's a thing you can't do, or you're like, I don't know if it's my project is big enough for that, maybe look elsewhere. The Health Resources and Services Administration. This is again one of the primary funders for health program grants. And I'll say the difference between health program and health research is programs are often funding things to do for you to do things. So develop a workforce, um, educate mothers about fetal alcohol syndrome and try to get them to change those sort of behaviors, organize healthcare systems to increase efficiency. It's a lot of doing. And the distinguishment between research grants is that there you very much have a research question and it's something set up. And you can still do things under that. And frequently you do have, whether it's a program or a method you're using. But there's much more a set systematic approach, whereas HRSA looks a little bit more just funding programs broadly. So probably a way to think about it is all health research is a health program, um, but not all health programs are research, if that makes sense. But some things that HRSA funds, because you probably haven't heard of them, or if you have, you might not really know what they do. They are focused on a lot of different things. So health equity, public health, workforce development, maternal and child health. Those are sort of the big areas. Rural health is another one, and telehealth too. Uh, so they are all working on these bunch of different topics. They're sort of the catch-all for everything that really doesn't fit under any of the other federal agencies. They do a lot and they fund a lot, and we have a couple of grants from HRSA right now. Um, the National Institutes of Health, probably one you've heard about. They are the premier health research agency and funder in the country. Um, they fund a variety of research focused on health on a variety of topics, and an important consideration as well is the stage of the career the researcher who is applying. So if you are fresh out of your graduate program and you want to start small, take whatever maybe you started with your dissertation and grow from there. You're an early career researcher. So there's specific funding for you. So you're not competing with someone who's established and maybe has 20 years of experience and several other grants. There's mechanisms to sort of set people apart. In addition to sometimes they have one-off funding things. So Congress will say, we want to fund research into a specific type of cancer or a specific type of cancer treatment. So sometimes they have one-off funding like that as well. And so it makes it a little hard to keep track of what all NIH is funding, but that's why we have grant search tools like Pivot. But they fund a variety of things again. One's probably most relevant to health sciences are the National Institutes of Nursing Research, the National Institutes of Minority Health, and I know we've also had some National Institutes of Cancer awardees as well in the past. The National Science Foundation. So maybe a different type of funder. They do fund health research, but not necessarily the type of research that NIH is doing. Think of it as basic research. So this is what we would think of a lot of the laboratory research being done into certain, biology, chemicals, molecules. I'm not that world, but also they do fund some different things in terms of mathematics, computer science, and again, they're also divided into different directorates as well, like NIH. The ones most relevant to us is, I believe, the Directorate on Behavioral and Social Sciences, because you can get a little bit more maybe of the public health or service delivery. But NSF is maybe the one I would probably not recommend from the start, because again, their focus is much more on the hard sciences. So if your research is that, by all means go, but also maybe look at other funders too. And then PCORI, this is focused specifically on comparative clinical effectiveness research. And what does that mean? It's a little bit nebulous, but they are basically looking at, they want to compare clinical effectiveness of different interventions. So looking at, I think one of the ones they were looking at was specifically related to diabetes prevention and how different interventions worked on different populations. And specifically, this is also focused on um, participatory research as well. So empowering patients to be a part of the research development, data collection, and advisory process. And it also funds additional things too, besides just basic research. So engagement around these topics, dissemination of information, and implementation is the primary research one. SAMHSA. This is the Substance Abuse and Mental Health Services Administration. They're public health focused, but they're very narrowly focused on behavioral health. So they fund a lot of the public behavioral health infrastructure in the country. They also do some other one-off things, such as funding for rural EMS training, as well as doing some work with the courts as well, because there is a big intersection between our courts and people with behavioral health problems. So funding anything behavioral health focused, I would suggest going SAMHSA first. And if you want to learn more, these are the links to finding the grant opportunities for these agencies. You'll notice CDC is not on here, and that is because they make finding their grant opportunities very difficult, and they don't put it all in one place, and they separate it out by their 20 different departments, and they all have different websites, and they're not always updated. But what is always updated is either grants.gov or Pivot. So that's why we recommend using that. I'll stop right here for federal and see if there are any questions. All right. So then let's move on to non-federal. These are just a couple that I found that might be of interest generally to health sciences. And some of them are probably names you know, have heard of before. Some of them might not be, but we'll go through them. Polaris invests in company communities. So if you're looking at a project in Vermilion specifically, they fund and provide grants for anything in the radius of one of their facilities. So Polaris has a facility in Vermilion, and they fund these different topics. So if it's related to any of these, might be a look. They don't do big grants, but if your topic is around one of these things, it would be a great opportunity. And because fund, they have such a limited scope in who they fund, there's a decent chance you probably get it. The Hearst Foundation, they fund a variety of things. And health is just one part of it. Their specific health priorities are listed there. As you can see, they're a national funder, so it's going to be competitive for their funding. And sometimes they might even say, we're not accepting any proposals right now. And that's sort of the thing you have to worry about with national foundations is sometimes they say it's invitation only or we're not accepting proposals. But Hearst is a good one to look at, especially if you're looking at issues of access, professional development, research, and behavioral health. The South Dakota Community Foundation is another great resource, and USD has gotten several grants for these in the past. They fund a variety of great things. The one thing to keep in mind with South Dakota Community Foundation is they like you to bring money to the table. So what I mean is, say you are wanting to get funding for $10,000 to do a community program around healthy eating in schools. South Dakota Community Foundation doesn't want to be the sole contributor for that $10,000. They want you to find funding elsewhere. So that is something to always keep in mind, and that's an expectation. I don't know that it's a hard and fast rule, but it is that they want you to sort of bring some money already to the table because they don't want to be sole funders. Also, they like to fund one-off things. They do not like to fund continuing things, and that's usually the case for most private funders. Is um, they want to make one-off investments, and then from those one-off investments, see those investments become stable, so they don't have to keep supporting them. So then they can go fund another thing. Is really their thinking. The Bush Foundation is similar to the Community Foundation, except it's a regional focus. They do a couple of different grants at different levels. But again, here they're focused on community-oriented problem solving. Um, and they're focused North Dakota, South Dakota, Minnesota, and the 23 Native nations in that region. This is one where I would say do not just go ahead and apply for this. They usually list program officers on their website. Reach out to the program officers with your idea first before you even consider applying, because they might be able to tell you, yes, this fits with what we're looking for, or no, apply in 2025 because that's when our new budget starts. So I'll have more money to give you by then. Um, it's always good. And that's probably a good rule of thumb for most of these private foundations is if there's a contact information, reach out to talk to them first, um, so that you can figure out, say, hey, this is what we're looking at. This is what we want to do. Does this fit with what you need or what you're looking for, etc.? Is there funding available too? The Medica Foundation, Medica is a insurance provider. So this is their philanthropic organization. And you'll find that for most insurance providers, Delta Dental is one we've done for oral health projects in the past. I usually have state or states foundations. I believe maybe Delta Dental of South Dakota might be both North and South Dakota. Um, but Medica is one that we've looked at in the past. They don't do funding for projects in South Dakota, but if you're based in Minnesota, Iowa, Nebraska, that's where you're looking to do your project. They fund a couple of different things as well. All right. And then lastly, the Robert Wood Johnson Foundation. This is again another one of those competitive national funders. Um, One of their big focuses is health equity, so projects related to that, as well as other systems, healthcare communities, healthy children and families, and leadership for better health. Um, Again, these are competitive. Sometimes they vary on what they're accepting for funding. I believe they're always accepting funding and related to proposals related to health equity, but otherwise they have sort of one-off RFPs that they're not great about announcing to the world that they're doing. So again, that's the benefit of a search tool like Pivot. And links are here. I will send this out to everybody afterwards. Um, so everybody who's registered or who has joined the call today basically will get this. Um, and we might also send it out to the Ori listener as well, along with the link to the recording. So if you want to go back later, listen to anything I said about it, by all means. Um, Before I get to using pivots and showing you how I'll do a grant search, if you would prefer Ori to do a grant search or an initial grant search for you, you can use this link here. Um, that will direct you to a Google form that you'll fill out, and we'll try to get back to you as soon as we can. Um, Again, when doing those grant search requests, it's helpful to have more information. Sometimes I get requests that are just like maternal health. And maternal health is a great thing, and there's a lot of grants out there, as we'll see. But sometimes it's always helpful to be more specific. So say, hey, I'm interested in maternal health related to postpartum issues around mothers with substance use. Okay, that gives me a lot more to help narrow it down because otherwise I'll provide you a list of 100 grants and half of them probably won't even be worth your time reviewing. So the more information you can provide for that search, the better. And then also in doing your search as well. Thank you, Claire, for putting that in the chat. That's the link as well. Any questions before I move into Pivot? Or I pivot into Pivot, I should say, if I'm being funny.
Actually, I do have one question for you.
Emma, I can't hear you for some reason.
Oh, weird. Okay. Let's see.
I can hear Emma.
Okay.
Oh, did I like mute myself? No, speakers are
Can
on.
you hear me now or not? Okay. I can type my question.
Okay, let me try that again.
Can you
Okay.
hear us now,
Can,
Nathaniel?
yeah,
Oh, what is up? Computers, they never work.
that's okay. Um,
Let's see. All right.
mm,
Emma, can you try speaking again?
yeah. Can you hear me now? I'm gonna
No, I
type.
can't. I
I'm
can read your
typing
lips
my.
though.
Okay, I'm typing
Oh,
my question in the chat.
okay.
Um,
Um, okay. Well, I don't know what's happening here, but my computer is apparently deciding to not be great. Yeah, if you could type out your question,
yep.
that would be great.
Okay.
Okay. All right. So while Emma's doing that, um,
I
this
think I
is
sent it.
Pivot. This is the front page for all of that. Um, okay, why can't I even see your chats? Okay. Keep there. Appreciate that. I don't know why my computer is just deciding to be terrible today. Um, all right, so going back to the South Dakota Community Foundation, if we were to expand our pregnancy center to another area, could they fund the new building if we sustain the org later with further funding? No. So the issue with a lot of grants is that things related to construction or buildings, um, they sort of have their own funding opportunities. So those will be what are called capital projects. And there are grants out there to fund that. Some grants are very interested. There's loan programs out there as well. Um, there are places like the federal government that will provide them if you fit all of their criteria. Um, but most public funders will say we don't fund construction. Um, They'll also say they don't probably fund things like equipment, which is usually anything over $5,000. Um, so, but it depends a lot. Uh, okay. So sorry, like it might not work necessarily like that, but we'll try and see if we can find something here. All right. Can everybody see my screen about Pivot here? Hoping so. Um, so this is Pivot. If you're able to get in, pivot.proquest.com. You'll probably need to log in with your USD credentials, um, and you'll need to select USD the from the background. I have no idea what my computer is doing now. All right, so let's just do a search. I know someone had asked about maternal health, and like I said, when you search maternal health, it's a lot. But there's a couple of things we can do. So Pivot acts a lot like any other research database. So if you've taken the introductory training through the library of this is how you use the data, or this is how you search for articles, it works a lot like that. So the reason this is so big to begin with is because it's 10,000 results that include either maternal or health. So one way we can fix that is we want maternal and health. So we can just go here and refine our search and say it's maternal and health and see what that does. So already that limits it down quite a bit. The other thing you'll notice is um, there are a lot of international funders in Pivot because it's an international database. So you'll get stuff like Australia, the UK, Canada. And sometimes you might not want that. It depends a lot on what the program is that you're doing. For the most part, for health sciences, we usually say it's going to be domestic. So one way you can sort down is usually countries are funding in the place that they are. So you can sort down by the country of the funder. So that's another way to limit the responses. So great. Now we're about down to 128. And you can see there's a bunch of variety of different things. But so let's look at this. Notice this special interest from the NIH. This one, this is what Pivot has on everything about this opportunity. This is specifically looking at interest related to children's dental, oral, and craniofacial tissues, and how it might be related to maternal health, as I understand it. Tells you everything looking to fund, who is funded, and also the due date. It gives you a little bit of information. This is an interesting feature of Pivot that I'm not sure how useful it'll be, but it can be. It'll find people at USD who are possible collaborators for a grant. So say you're new and you don't really know very many people. You can find other collaborators who Pivot, I believe, has determined might be people who fit. And it will connect you all with them. It's a great feature, especially if you're looking for collaborators. I haven't used it because usually I'm not looking for grants for myself. I'm looking for grants for other people. And then, so say I really like this, I can go and track this to say, I want to go back to this later. It's now tracked. And so what that does is I can go to my profile. Go. Well, oh, here it is. It's under tracked opportunities. I swear I always look under profiles, but so this will look at all of the grants I've saved. Looking at a bunch of different ones that are out there that might be of interest. So you can always go back later, create a list. And then the other cool thing you can do is you can get what's called calendar view. And so that will pull up a calendar with the dates of when everything is due. And so it'll say, okay, well, I've got this AHRQ one that I'm looking at. Oh, that's due in 2 weeks. I'm probably not going to get that done in time. Probably not one to do this time. But I can go out farther and see, okay, I don't think I have anything due for a while. Okay, that's good. That'll give me plenty of time to sort of schedule things out. Okay, I don't have this nursing grant due until the end of January. Great. And now say, because you live or die by your Outlook calendar, you can download all of this information into a thing that you can upload into your Outlook calendar. So you can have a deadline in there. Say you're tracking things based on anticipated dates. That's this one. So this proposal is anticipated, meaning the National League for Nursing has not announced that this is coming out or that this is what the date is, but this is when Pivot thinks it will be based on prior proposals. So it's a good way to keep track if you have a couple of different proposals or trying to schedule things out. Questions so far? And I'll see if I can hear people this time. All right. So another question. So the maternal health one was pretty straightforward. But I know other people were interested in things related to like sexual risk avoidance, sexual abuse, child abuse prevention. So let's try another one. Let's try just searching sexual abuse. So here again, because it's search sexual or abuse, we gotta do a little bit of refining. So we know just sexual abuse, and then because we know some things about it, we probably want to put in prevention. Prevention and maybe education. So this will look for anything that has sexual and abuse in it, and then either prevention or education. And that gets us 47 results, most of which look like they're in the US. So we don't even need to actually do some of that. Well, it's South African, but um, Pivot, sort of like any research database, like there's only so much you can do with the search results to sort of filter it out before you go in and look. And I suggest probably not doing too many filters. Um, Besides maybe the country of funder one, because you'll see a lot of this here. It varies. Some of these fields might not even be in Pivot, so they might not say what type of applicant they accept, what the funder type is. So you might be limiting at things that might fit with what you need, just because Pivot's information isn't complete for everything. But it's a good way of it's a lot easier to look through 47 results and then having to look through, say, 10,000 or not even know where to look. Especially in terms of these CDC ones, like I mentioned, CDC is terrible about making it easy to find out what grants they have available and where. So this one, it says, oh, this is a great program to evaluate programs and policies on child sexual abuse and problematic sexual behavior. Great. Tell me a little bit more about it. All right. Investigator research proposals, child sexual abuse, problematic sexual behavior. It defines what that is. Prevention, very important for CDC as well. So always a thing as well. Looks like a pretty good opportunity for someone who might be there. And then eligibility. All right. So if I'm applying through USD, I need to see public or state controlled higher institutions of education. So USD would be eligible. Okay, so then important dates, because it does require a letter of intent, but Pivot is saying deadline's not required, letter of intent's not required. I still usually recommend that if you can do it, um, just do it because it's a good way of getting some initial feedback and at least letting them know, hey, we're going to apply with a deadline of December 2nd. Great. And Pivot had this useful little bit of information to say, okay, say you're swamped this November, but it's probably going to be repeated once a year. So you can take your idea, workshop it, keep an eye on it, and then plan to apply and submit in 2024 or in 2025 when it comes back up again. Again, Pivot is a human generated database. So that means it's not perfect, it's not errors. So once you find something promising, I always recommend you go to the link they provide for the website, which is grants.gov. Look at it, verify the information that's in Pivot. I haven't really found an inaccuracy with Pivot yet, but it's always good to just double check to make sure everything's right. I'm not sure how quickly Pivot updates things, so sometimes deadlines change, eligibility changes, etc. So it's a good thing to keep in mind as well. So that's that. So that's Pivot. Um, but so one final feature I'll say, um, there's a good chance when you go to search for your funding, you probably won't find what you're looking for. And that's because the odds of your research idea lining up with what funders are willing to fund, it's probably 50-50 whether you find something. And then 50-50 or whether that something is actually a good fit for your idea. So you want to sort of keep track of things because maybe something will come up. And that's the really cool thing about Pivot. It'll keep running your search. So I'm going to save this as essay, mention, and ed. And I want to receive a weekly email containing new or updated opportunities. So what this does is every Sunday at like noon, I think, it sends you an email saying it reruns all of your searches and says, okay, these 3 new opportunities showed up in your search. And you can go in and look at them. You're always on top of things. And you can save it. And now it's there. And you can go and find those by, again, just going back home and looking at save searches. So you'll notice here, I have a bunch of different searches that I'm doing. And a lot of these are because they're searches that have been requested by other people. So one of the things you'll get if you do a grant search request through us is you'll say, we're saying, here's what we found, or here's what we didn't find. We also keep track of things. So if something comes up again through this search that we think might fit with what your request is looking for, I'll send you an email about it so that you know. It's a good way to keep track of everything. And then I guess for students, one last thing I'll show for students. So these were things I'm looking, disclosure, I'm a PhD student in the health sciences program here at USD. So is interested in looking at what programs are out there for dissertations, or even some graduate programs require a capstone project, or other projects as well. There's a lot of good programs out there. This is just what's new. You can look at all of them. And so this is if you are a student and you're specifically looking for dissertation funding, this is where I'd recommend doing your search terms, so say maternal health. But then looking again at sorting down by funding types. So dissertation and thesis funding is one category you can go, and you'll find a lot of different ones that usually related to a bunch of different things. So it's a good way for students to keep in mind what's out there for dissertation awards, what's out there for things I can use to fund my research, because as students, that might be a little hard to do. And there might not necessarily be funding out there for you that you think, but there are some. So if you're a student and I realize it's a pretty big world to navigate, feel free to reach out, and we'll help you identify that as well. All right, I'm going to stop sharing my screen. Okay, now stuff is actually showing up again. All right, so before I sign off for the rest, is there any other questions about Pivot, grant searches, grant funding, anything you saw? Any questions you have? I hopefully will hear you this time. I don't know. All right. So if you have any questions, by all means, feel free to email us, ori@usd.edu. We also have a listserv that you can subscribe to. Clara, could you find the link and put that in the chat? I'm assuming if most people are on this, they're probably on that list. But if you are, we frequently send out things, send out opportunities, send out other additional trainings. Our next training is a great one that Clara and Dr. Diamond Welch are going to be doing on demystifying the IRB process. And it's going to be on Halloween. So costumes are not required, but they are strongly encouraged. So bring your questions. I believe there's a place to sign up and for that as well. So when you sign up, ask your question as well, or come with your questions. But they're good, and that session will be recorded as well and up on our YouTube channel after a little bit. All right. Not seeing any other questions, but I'll let everybody go and have a great rest of your day.